Welcome to the She Found Motherhood podcast. Today, Krysta Norwick, Pelvic Physiotherapy, is joining me to talk about all things pelvic physio in pregnancy. We discuss how we can use pelvic physio to help us prepare for labor and delivery and how to use your pelvic floor during your birth. We also discuss pelvic floor dysfunction and what that can look like in pregnancy, including painful intercourse, having leaking, urine leakage, and also constipation, and how pelvic physio can actually help with those symptoms. So we're really excited to dig deep into this today. Now, my dog has decided that he wants to be a part of the podcast, so ignore a little bit of the whining in the background. I do apologize for that, and we'll get to it right after this. Now, don't forget, if you do want to learn more about childbirth, please join us in our online prenatal course at www.shefoundhealth.ca under the courses. We go over everything from preparing for labor and delivery, through labor and delivery, and what that could look like, how we can use breathing and what pain medications there are. And we also talk about that fourth trimester, or the first kind of 3 months after delivery. It's a comprehensive online prenatal course that you can watch in your own space with whomever you want, and you can watch it over and over again as well. It is one of the most comprehensive prenatal courses that we've seen for sure. So we hope that it is helpful for you. Again, check it out at www.shefoundhealth.ca. Welcome to the She Found Motherhood podcast, where our goal is to support you in the journey from pregnancy through to parenthood. We are so passionate about this time in a woman's life, and we want to make sure you have fun and reliable information you can trust. She Found Motherhood podcast is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This does not apply to every situation. If you have questions or if you have received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Hi, Krysta. Welcome to the She Found Motherhood podcast. We're so excited to talk today, and I think you're going to talk about pelvic physio and its importance during pregnancy. We often think about it for the postpartum period, but you have educated me, and now I'm starting to refer my patients to amazing pelvic physios like yourself during pregnancy, because there's so much work you can do during that time to prepare for kind of birth and the postpartum and deal with issues that come up during pregnancy.
Yes, exactly. Thanks for having me. So excited.
A pleasure. So why don't we start off talking about kind of what changes occur during pregnancy?
Absolutely. Yeah. So, as a physiotherapist, I have lots of training in the musculoskeletal system. So, I'm really looking at that system. Whereas typically, a physician like yourself would be looking at all the organs in the system. And I'm looking more at the muscles, joints, bones, ligaments.
Sorry, my dog is in the background whining, so just ignore him, everybody.
That's the perspective I'm coming from. So I'm thinking about the joints, the ligaments, the muscles, the bones, and I'm not really thinking as much about the organs. So my role as a physio is to think about that aspect of how your body changes. So as you progress through pregnancy, most people understand that the belly expands, right? So you start to show and your belly starts to expand as baby gets bigger. And what needs to happen is your abdominal muscles that kind of form that wall of your abdomen need to also expand in order to accommodate for the baby taking up more space in your abdomen. So those muscles will lengthen and your muscles will need to kind of stretch out in order to accommodate that. So that's one thing that happens. The other thing is the pelvic floor muscles, which are the muscles that attach on the inside of your pelvis. So those are the muscles that you could touch if you were to push on in between your sit bones. They attach from pubic bone to tailbone out to your sit bones. And those muscles are really important for holding up your pelvic organs and supporting your pelvis. And they also play a role in bladder, bowel health, a few other things. So those muscles, they also need to adapt as you move through pregnancy because you're asking them to do a bit more by holding more load, so holding a bit more body weight. And there's also a few changes in kind of the joints themselves that your pelvic floor will try to accommodate for. Now, Oftentimes, what we see with our clients is that the pelvic floor will tend to get a bit tighter as you move through pregnancy because it's working harder and tightening up. And that's usually what we see. That's not always the case, though. And then, in terms of your ligaments, as you get closer to your due date, your ligaments will get more lax. And that's in preparation for labor and delivery, right?
And our ligaments are the connective tissue that attaches our bony parts, as opposed to
Yes,
tendons, which attach our muscles to our bones.
yes, yes,
So our ligaments
exactly.
are like in our pubic bone, kind of
Yeah.
supporting our pubic bone, that type of thing.
Yeah, exactly. So your pubic bone, there's your pubic symphysis, which starts to get a bit more lax. And then at the back of the pelvis, you have where your pelvic bone it articulates or attaches to your sacrum. And so those start to get more lax and stretch out in order to prepare your body to be able to actually open those bones up more for labor and delivery. What that means as you're walking around doing things throughout your day is that your joints aren't as stable just naturally as they were before. And so your muscles have to start doing more work. And then the only other change that I often think about is just how your load through your body is changing. So as you gain weight, how is that load then distributing through your pelvis, your knees, your legs, your ankles, and just how that might change how you feel in your body and how your posture is based on where the weight of the baby is sitting.
Yeah, like your center of gravity shifts too, right? Is
Absolutely.
what we're talking about.
Yes.
Also with that ligament laxity, we're a little bit more prone to general instability. So just being aware and holding more weight, your center of gravity is different. So a little bit more prone to kind of falls and injuries a little bit as we progress through pregnancy, right?
Mhm.
I'm not making that up, am I?
Yeah,
I
you're not
too
making
make
that up. And
I do
we
make
are
stuff up sometimes.
we are prone a bit more to getting aches and pains in those joints too as you get later on in pregnancy because you don't have that same stability that you're used to having, and you're also carrying a baby, which is adding more load through your joints, so it can be a lot more challenging. And naturally, most people start to notice they just don't feel like doing as much exercise or as long of walks, for example. They just start to shorten naturally on their own. But that's also where a physiotherapist can help you understand, okay, what is the edge? Like, how much should I be doing and how much doesn't feel that great for my body right now?
Yeah, and as you and Dr. Sarah taught about in your last podcast, you joined us with there's a lot of evidence around staying active in pregnancy actually reduces those aches and pains and makes for an easier delivery and postpartum recovery as well. So
Yes,
certainly getting some guidance around kind of safe activity at your stage and with whatever is challenging for you is really important. And pelvic physio can be so helpful in that realm. Hey.
absolutely.
So, what is the role of kind of a pelvic physiotherapist there's my dog again, in supporting women through this transition or people through this transition of pregnancy?
Yeah, so we already started to touch on it, but as a pelvic floor physio, any pelvic floor physio is extra training and understanding the role of the pelvic floor in your body, how you use your pelvic floor, how it's then going to be utilized, or what role it plays in labor and delivery as well. So, a really huge role that a pelvic physio will play is teach you how to move your pelvic floor muscles, control your pelvic floor muscle movement. The vast majority of people have never really thought about their pelvic floor. Maybe you heard somewhere along the line that you should do your Kegels, which is another word for pelvic floor contraction. But most people don't really understand what that feels like in their body and what that really means.
It's funny, right
And
before you started talking about Kegels, I started doing Kegels. All right, too
nice.
much information. Go ahead.
You learn how to move your muscles, you learn how to tighten them, you learn how to relax them. And as you move through pregnancy, it becomes more and more important to be able to relax your pelvic floor. And that's really not well known. But of course, if you're in labor and delivery and you're having a vaginal birth and you need the birth canal to kind of open and you need the joints to open and the muscles to open, having that ability or that knowledge of how to open the pelvic floor, even if you can't feel it in the moment, if you have that muscle memory, that can be really helpful. And then, of course, just understanding, like we already talked about, what exercise is safe and appropriate for your body. And there's no perfect black and white exercise prescription for every person during pregnancy. It varies so much on, and it depends on things like what your pre-existing activity level was like, what you generally like to do for exercise, and how you're feeling during the pregnancy. And just like you were saying, really important to be able to stay as active as possible.
Yeah, and with all of those changes in our body, what we're used to doing may or may not be capable, or we have to adjust it, right? And so
Yeah.
that's where kind of some guidance from an expert like yourself can be really, really handy.
Yeah, absolutely. And like I said, it just can't be, a one program for everyone solution because we're all so unique and pregnancies can be so variable as well. So it's really great to have that just extra guidance from a professional to know, okay, this is a great exercise for me. Then the other thing is we help support your body in the with your laxity. So we were already saying your joints become a bit more lax, your ligaments become more lax. So we help your body with that and we help with specific exercises, whether they be pelvic floor exercises, core exercises, to help you actually maintain as much stability in your system as you can as you move through pregnancy. And sometimes that might be an additional support. Sometimes there's sacroiliac joint belts that people will wear at the end of pregnancy, and that's usually if you need a little bit extra support, not just whatever exercises we're trying to do might not be working. So we can help you understand when would be a good time to wear that and when it might not be a good time to wear that, or if it's appropriate for you. And then a huge role is preparing for labor and delivery. So, really teaching you how to use your pelvic floor, how to control the movement of your pelvic floor, how to use your breath in order to control that, and then practicing some of these positions that are common in labor and delivery that you might want to be able to stay in these positions, move around, and feel like you're a bit more confident in them as well. And so that is a huge role.
That's awesome. I'm surprised at how many people during their pregnancy start to have discomfort with intercourse or issues with kind of urinal leaking. That I'm not so surprised about. But
Mhm.
when people have never reported having problems before, it just kind of comes up in pregnancy, and there's a lot of fear around delivery that then happens, right? If I can't have
Right.
intercourse, how am I gonna push a baby out? And so I think that's
Mhm.
probably a pretty significant rule for pelvic physio. Can you tell us kind of a little bit about what happens when you do get a bit of dysfunction in your pelvic floor during pregnancy?
Yes. Absolutely. It's a very big role. And like we were already talking about, there's so many changes your body is going through that usually those changes in function are happening because your muscular system and your joint system is changing. And so it's not surprising that it happens. It's not uncommon, but it is something that pelvic physiotherapy can help with. So pain with sex is one, changes in your sensation. So maybe all of a sudden it doesn't feel good or it doesn't feel like you can actually orgasm anymore. Or you start having bladder leakage or constipation, hemorrhoids, anything bowel related. All of those things can be very impacted by the pelvic floor, if not kind of exclusively pelvic floor changes causing it. So the role of the pelvic floor physio in that is that your pelvic floor physiotherapist would evaluate how your muscles are doing, evaluate your ability to use them, activate them when you need them, relax them when you don't need them, and then optimize that. So give you exercises and things that you can try in order to get on top of the dysfunction. During pregnancy, it can be a little bit trickier just because you're progressing through pregnancy. It can sometimes be a little bit trickier to really get on top of the symptoms, but it's absolutely possible. And just clinically, I've seen so much success with working with my clients. And like I said previously, most people don't have a really good understanding of their pelvis, their pelvic floor. And so just with giving someone that understanding, that knowledge, it can make a huge difference. And then the other thing that I wanted to touch on with pelvic floor dysfunction during pregnancy is there's often aches and pains associated with pregnancy as you go through. So you might get pubic symphysis pain, round ligament pain, fire crotch is one I've heard.
Lightning crotch, we like to
Lightning
call it.
crotch, sorry, lightning crotch, knees, hips, things all kind of around that area, lower back. So some of those symptoms are a bit more kind of pregnancy related, like maybe baby is pushing on something, or as your belly expands, that's creating some of those symptoms. But some of them can actually be either dramatically decreased or resolved with some pelvic floor physio. And usually we're not just looking at the pelvic floor in that case, we're looking at, okay, pelvic floor, glutes, core, back, how's everything working together? And there's a very big role for physiotherapy in that pain management if any aches and pains come up. And I'm usually working really closely with the care provider, a physician or a midwife, in terms of what's your clinical impression of what's going on, and then my clinical impression of how are the muscles and joints and how the body is moving, potentially impacting this discomfort as well.
And another one that commonly kind of comes up, not commonly, but comes up not infrequently is kind of sciatic pain that's new in pregnancy, or that kind of back pain that goes down your leg. And so
Yeah.
that's one that I often suggest physio, and certainly people can get quite a bit of relief. But one thing I just wanted to recap, pelvic floor dysfunction is common and we can help you. So if you are having pain with intercourse, if you are having constipation, if you are having leakage, do not be shy. Ask for help. You are not alone, and that is literally why we are here. That is the end of my
Yes.
public service announcement. I think we
Love
all
it.
get very shy and we don't want to talk about certain things, but this is what we do all day, every
All
day.
day. Yeah.
You cannot surprise us. I mean, I'm sure you
No.
could if you really tried, but like it's got to take a lot to surprise us. So do not feel shy. Talk to your care provider. That is why we're here and we want to help. We want you to have the best pregnancy that you can. And we can help. And may not make it perfect, but hopefully it'll get better.
Absolutely. Scream it from the mountaintops. I am always trying to educate as many people as possible. It's what I chose to focus my entire profession on, is focusing more and more on this. A lot of people say, "Oh, is that too much information?" I'm like, "No,
No, I
that's what
talk
we do."
about poop all the time.
Mhm.
Um, so
Exactly.
can we kind of talk about like what does a pelvic floor physio visit look like? Like what would an initial visit kind of look like?
So, a typical pelvic floor physiotherapy session is going to look different depending on where you live, who you're seeing, and the physiotherapist in general. But no matter if you're seeing someone in person or online, which is how I practice, you are going to first go through your medical history. The physiotherapist will ask you a bunch of questions about your general health, how the pregnancy is going. If you're pregnant, sometimes I'll see people even prior to pregnancy when they're trying to conceive. Also, a great time to start chatting with a pelvic physio. Get a sense of where you're at when you arrive at that first session and what your goals are. And then based on that, there will be an objective assessment. So, an objective assessment is when the physiotherapist analyzes some of your body movements. And if it's over video, so telehealth, which is online video physiotherapy, you would observe the person doing different movements over the screen and then do lots of verbal cueing to figure out how the person's awareness of the core, pelvic floor, that whole region is. In person, it might look a little bit different because the physiotherapist can touch you. And so the physiotherapist might put their hands on you as you're doing a few movements. And then, depending on your comfort level and how the physiotherapist practices, an internal vaginal exam is often part of the assessment. That's always your choice, though. It's not something that you need to do, it's always your choice. That would mean that they would be inserting one of their gloved fingers into your vaginal canal and feeling your pelvic floor. Sometimes that wouldn't happen during pregnancy if you've been told by your care provider that that might not be kind of a safe choice for you. I don't know how
So
often.
reasons, yeah, reasons for that would be kind of if you've got a placenta previa, or if you've had threatened preterm labor, or if we know you have a short cervix, those would be reasons that you probably wouldn't want to kind of that internal exam. Not that you're really going that close to the cervix, I'm sure, but safety
Mhm.
first. So
Absolutely, yeah. And so I always will double check that. And if you know that you're not supposed to be doing an internal exam, then you're absolutely, there's lots you can still get out of physiotherapy. That's not a necessary step, but it can be a step that definitely gives us more information on how you're using your muscles, where you might be tight, where you might not be activating super well. And then some physiotherapists use biofeedback, and that is basically a couple electrode sensors that can sense your pelvic floor movement through kind of the electrical experience that happens in your muscle itself. And so then the actual feedback meter will tell the physio, and usually there's a visual thing that you can see on where your muscles are moving. Obviously, I'm kind of jumbling my way through it because I don't use it in my practice because I'm seeing people online, but there are several practitioners I know of that use it and utilize it depending on the client and if it's appropriate for them. And then based on all of that assessment, that's when you would be given your exercise routine and your homework. So much of what we do is education. So giving you tips, tricks, things to do in order to maybe get on top of dysfunction if you have it, or learn how to use your pelvic floor on a day-to-day basis. And then if there's any weaknesses, or if you don't have a good ability to relax, or you're wanting to know how to exercise your core well, then you'd probably be given a physiotherapy exercise routine. And that is how you would start. But then, of course, we would usually need to do some follow-ups just to see how you're progressing with that.
But I think it's really important to remind people that it takes time for our bodies to get to these points, right?
Mm.
So I suspect a lot of people with pelvic floor dysfunction actually had a component of it to pre-pregnancy, and pregnancy just made it worse or exacerbated it. So I think it's really important that it takes time for us to get to this point, which means it takes time and work to get over it or to make changes. And so none of these things are like quick fixes or, snap your finger and it's there. It takes time, but that time invested can make a huge impact, both in your pregnancy, but also in your postpartum and future pregnancies. So learning how to use our muscles more effectively is so important. Just like if you go to the gym and you've been doing something wrong the whole time and you've got this weird imbalance. I'm talking about myself here. And then you see your trainer and your trainer's like, "What have you been doing?" And then you have to retrain your entire kind of way of being. But in the end, it works much better. So just really important to remember that this is a process, an active process for everybody involved. So
Yeah, that's a really, really good point. And yeah, your body needs time to adapt. And your physiotherapist should tell you, based on our assessment or based on maybe the first couple sessions, this is how many times I think would be the most appropriate to see you, or this is the frequency as to which I think would be the most appropriate. And that's just using our clinical reasoning skills to know kind of how people have progressed in the past and how we think your body might do best and how much guidance you might need.
awesome. And what might the homework look like? I can imagine in my head what it looks like, exercises, but or stretching and strengthening. But what might be some pieces that you might suggest to people with some pelvic floor dysfunction, for example?
Okay, so the exercise program that you might be given by your physiotherapist will look pretty different depending on where you're at, how the assessment went. But usually, when you're first learning how to activate and then relax your pelvic floor, those exercises will be hard to even tell that anyone's doing an exercise. If I was to look at you right now doing them, I wouldn't be able to tell because you're not moving any limbs of your body. You're just moving the pelvic floor in between your sit bones. So it usually starts off like that. But then as you gain the ability to use your pelvic floor and activate it when you need it, relax it when you don't, we'll usually then integrate that new skill into more functional movements. So I might get you to practice that standing, balancing on one foot, squatting, depending on your specific goals. We'll then integrate that into those movements. And then usually I'll also add in a bit of a core routine or a general kind of strength and conditioning routine or give people guidance on that. So those might look a bit more like a exercise you might recognize from the gym or something that looks a little bit more like yoga, but with that extra integration of that awareness of your core, awareness of your pelvic floor. So, I'll give people cat cows often, which is a very classic yoga move, or child's pose, or practicing different positions. But I think every physiotherapist also has their own favorite exercises that they might give. So it might look a lot different, but the principles are very much the same.
Awesome. And you kind of touched a little bit on this, but in terms of kind of preparing for delivery, like, is there anything kind of specific that you recommend? You kind of said that you had practiced some positions, which is awesome. I never even thought about that.
Mhm.
Like I said before we started, I learned so much from doing these podcasts. But what else might you and your client kind of discuss around that?
That's a great question. So On average, I would say I see my clients about 3 times during pregnancy, so approximately once per trimester. If you have any dysfunction going on, it might be more frequently, or if you have a hard time getting on top of the exercises, it might be more frequently. So it varies a bit, but usually in my closer to the end sessions, when we're getting closer to your due date, we start talking more and more about labor and delivery. And so, even from the first session, when I'm teaching someone how to really relax their pelvic floor and open their pelvic floor up, you're already preparing for labor and delivery because you're practicing that opening of the muscles. So, you're practicing creating space for the baby. But then, as we get closer, we practice a lot more labor and delivery specific things. So, we practice different positions that might feel good for the person in terms of what positions they might want to be in when they're laboring. So, giving them ideas of, okay, you can go on your hands and knees, you can do squat, you can do lying on your side, you can stand, you can many different kind of movements. And I'm sure you have even more ideas as well. And then for delivery, we always discuss different positions for delivery. And there are, I think in mainstream kind of media, movies, everything like that, you always see the person delivering on their back. And so I always just like to educate my clients that although there might be a reason why you will deliver on your back, depending on your care provider, how baby's doing, how you're doing, everything, there are other positions you can deliver in if that works for you, if it works medically, all of that. So we just chat about that and we talk about how the pelvis and the tailbone has a bit more movement in positions like hands and knees or in like a supported squat position than if you're lying on your back. But I always say, of course, in the moment, if there's anything that your medical provider is telling you, okay, baby doesn't like being on your hands and knees, we have to switch it up. That's always, of course, number one. So we talk about that, and then also just getting the person to practice those pelvic floor expansions and openings in some of these different positions. So, like hands and knees, sitting on a ball, any positions they might want to utilize during labor and delivery, and just practicing relaxing opening as much as possible so that it becomes just second nature, muscle memory. A lot of my clients will report they couldn't really feel the muscles during labor and delivery. Some people can, some people can't. And really, we're just trying to create that muscle memory so that the muscles just know, okay, this is how I open, this is how I can create more space. And then about 1 month before the person's due date, around that time, is usually when I start getting them to work on perineal massage. So that is a way that you would insert your finger, or you'd get your partner to insert their finger into your vaginal canal and stretch some of the pelvic floor muscles and connective tissues in the area, just to, again, just stretch them out, get them prepared for delivery. And that might be different depending on different medical reasons. Like we already mentioned, like maybe not wanting to do internal work, so maybe you would just do perineal massage on the outside.
Well, if
So
you're
I
gonna
would
have a
say,
vaginal delivery, doesn't matter at that point. So anyone
right,
who's planning
getting
on a
close,
vaginal
yeah,
delivery, have at her. If you're planning on a
yeah,
cesarean section, doesn't matter. And we've got a handy, Dr. Sarah put together a handy little cheat sheet download around perineal massage. So I'll make sure to link
awesome.
that as a little guide people can use to do it.
Love it. That's
Um,
awesome. And
yeah.
yeah, just I try to get people to work on it every day if they can. And it just helps prepare the tissues for vaginal delivery. And it's even if you end up having an emergency C-section, or if you do end up having a C-section, it's still fine to work on the perineal massage leading up to labor and delivery.
Yeah, for sure. And one point, I think it's amazing that you have these discussions with pregnant people around kind of pushing positions and delivery positions, because it is entirely true. The way our pelvis works, different positions definitely allow different space. And so we are huge proponents of moving around in labor and moving around while pushing and having lots of different positions. I think what people forget is that once your baby is on your perineum and ready to actually be delivered, it's already past all of that. Like it's already stretched everything out. So people get very, and again, I'm happy to deliver you however you want to be delivered. It's harder for me to control your perineum and the tearing in certain positions, and I will tell people that. But by the time baby's head is literally there ready to come out, it's already kind of gone through all of the challenging places to kind of go through. So, yeah, I think people get a bit fixated on wanting to deliver in certain positions, which is fine, but certainly most of that happens during the pushing phase. So during that kind of
Mhm.
time leading up to it, and movement during that time is amazing, and trying different positions. And you're right, there's so
Mhm.
many things that we can do in that to help facilitate just your pelvis moving and allowing your baby to shift down into that nice low spot ready for delivery. So yeah, that's awesome.
Mhm.
And then some people, it just feels they're doing a great job in whatever position they are, and we don't need to move. And so but we certainly like to promote it if things aren't progressing or if people want
Mhm.
to, and that's wonderful.
Right.
Again, as long as baby's safe. Sometimes those babies
Yeah.
have weird positions and they're lying on their cord, and so you can never go on your left-hand side, but everything else is fine. So we just have to listen to those little babies. And then we're not talking about postpartum recovery, but when would you want, we do talk about creating a support plan and having your team, and part of that team is your health providers, such as yourself, a
Yeah.
physiotherapy, and making your appointments leading up to it. So when do you like to see postpartum folks after a delivery for that, like your first reassessment?
Usually the average is between 4 to 8 weeks, and it really depends on how the person is feeling, how healing is progressing. Because I'm seeing people online, I'm not doing an internal exam, so I'm just really giving education, movement strategies, maybe some gentle reactivation of the pelvic floor. If you're seeing someone in person and they want to be able to do an internal exam, you might want to wait a bit longer and make sure you feel ready for that. So it varies quite a bit, but I would say try not to wait longer than 8 weeks, because so much of what we can do is get that early intervention and get that early education, movement repatterning, and that just helps with your long-term recovery. And
Awesome.
that is the same no matter what your delivery was like. So if you had a C-section, vaginal birth, same thing. We should try to have those follow-ups. And you might need one or two follow-ups. You might need 8 or 10 follow-ups. Everyone is so different in that regard.
Yeah.
I had a question for you actually, because I obviously am not in the labor and delivery room, but I just did a course recently where they were educating us about the atmosphere of the delivery room. And what studies were showing is that the darker the room was, the quieter, that the pelvic floor was able to relax better, and that the nervous system was able to be a little bit more kind of relaxed and in tune with labor. Is that something that you kind of have thought about?
Oh, for sure. The
Yeah,
less stressful the environment, the more relaxed we are, generally speaking, right?
right,
And so the more anxious you are, or the more kind of stressful your environment is, the more tense you're going to be everywhere. So
right.
physically, mentally, everything. And so certainly we have, we try to keep things as calm as possible. We have, dimmed rooms as much as possible. People can bring in their own music if they have relaxation music. We are like huge proponents of kind of mindfulness meditation, which is essentially similar to hypnobirthing. So a
Mm,
lot of people kind of find that really useful as well. But yeah, no, it makes a huge difference. And if you
mhm,
have if you have faith in your care providers and you're trusting of your nurses and your physicians or midwives, then you're going to feel much more relaxed and able to kind of just go with the flow of what your body is doing, as opposed to if you're kind of anxious or the situation is challenging for
mhm,
whatever reason. And
right.
sometimes it has to be because it gets complicated, and that's just the nature of labor and delivery,
Mhm,
unfortunately. But yeah, the more relaxing the environment. So exactly, set up your environment in the hospital. You can't have scents, so no scented candles, but you can have your own music. You can bring your own pillow. You can,
mhm,
plug yourself into your mindfulness app. You can do all of those things just to try to bring more relaxation into your space, right? Some people bring their own
yeah,
pictures and that type of stuff. Yeah.
yeah. Yeah, that's great because I've started educating my clients about that, and just, yeah, if the atmosphere is kind of darker, quieter, then generally that's better for your pelvic floor. So,
I shouldn't really tell you the story, but I'm going to tell you the story. So I was induced with my first child, and my husband. So when you're induced with oxytocin, you're there for a while. Generally, first labors take forever and a day. So my husband was like, he brought his not his banjo, his ukulele, to learn how to play Happy Birthday to our son, which I didn't know was a
oh,
boy, but our son when he was born. And we got a nurse who's lovely, but quite talkative. And so the atmosphere, I had a blast because I quite like chatting with her, but the atmosphere for my husband was not quite as calm and relaxing as he had hoped. So, but again, everybody's different. So if you want quiet, you can make that request, like minimal people in the room or just not a lot of chit chatting. But if some people are much more relaxed if they are kind of chatting and bright lights. So
Yeah.
everybody's different, and do the best to create your own environment and ask for what you hope for. And we will do our best to accommodate. So, yeah. So, Krysta, how can people get a hold of you if they are interested in chatting with you about their pelvic health?
People can find me on social media. So I'm on Instagram at Cairn Physiotherapy, CAIRN Physiotherapy. And I own and run an online physiotherapy business called Cairn Physiotherapy. So you can find me at cairnphysiotherapy.ca, book online. You can always book a 15-minute discovery call, which is free if you have any questions, especially if you maybe aren't in an area where you know a pelvic floor physio. I can help connect you, or I can see you online. And I love answering any questions that you might have. As you might be able to tell, I'm just so passionate about trying to get more information out there for people.
So awesome. Well, thank you very much for talking with me today about this very important topic.
You're welcome. Thank you so much for having me on. It was really fun.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information. Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.